Being in healthcare is love in action. That's compassionate care, which means that you will exercise the same amount of thought process, the same willingness to go the extra mile, the same subtle nuances of, can I get you a blanket? I noticed that your food is cold. Can I warm that up for you? I know you've been standing here in the emergency room for 2 hours and nobody's asked to give you a chair. Or you've been here with your loved one. Have you eaten lunch? If I see no differences between those who I love the most and the ones that I'm caring for, that's what compassionate care means to me. Sometimes it's just a fist pound, sometimes it's a hug, sometimes it's a smile, but I'll tell you, it's there. The people who work at this hospital deliver this sort of compassionate care day in and day out, which is why this is a team recognition, just to highlight what they do every day. And I think that's a testament to the people who work here.
Being ill is not just about medicine. Dealing with terminally ill and dying children is one of the hardest jobs, I think, in healthcare. There are no real words to take away the pain of a parent who's losing a child. That's not possible. But what we can do is we can keep showing up. We can keep witnessing the suffering of the child and the parents and trying to comfort them as best we can and show them that we're not afraid to keep showing up to help them, to walk alongside them in this journey. Helping people at this most vulnerable time of their lives, this most intimate time, really inspires and really brings out compassion and kindness that I didn't know I was capable of. And so I get as much or more out of this work than I give.
I think as medical providers, we are caregivers to the human spirit. That is what we are privileged to do. There is something very satisfying and nurturing and nourishing about making a human connection. When you allow yourself as a physician to present as a human, you get access to ways of caring for a person that go far beyond what we learn in medical school. The physiology and the pathophysiology of disease and injury. And what we don't learn is how that's experienced by people, by a person. When you get access to understanding that experience, then you are able to provide much better care. I don't know that that's the essence of compassion, but I think it is the essence of providing the best care possible.
I think compassionate care begins with hope that from the very first time I meet the patient and family, that there is hope for some improvements in the problem that brings them to me. I'm aware that it's very difficult for a parent to open up and tell me what's going on in their home and with their child, and try to be very respectful and mindful that I'm being let into very personal aspects of their family. They know that I am listening, that I understand, that I genuinely care about their family and their child. And it's just tremendously rewarding to see what an impact this makes on these kids and their families. It's just the most rewarding thing that I've ever done.
I'm very attracted to the law of love, and all that I do, I try to live that kind of love out with everybody that I meet. I do a lot of intakes on people who are really desperate for help. They just don't know where to turn. Their addiction is totally out of control. My philosophy is never give up on them, and to give them that hope that at any point this can turn. Just keep coming, just keep showing up, keep doing the work, and keep hopeful. To be able to help that person to get stabilized is very rewarding. And when they come back and they say, Lola, I've got a job now, I've got a place to stay, my family's starting to talk to me again, that makes it all worthwhile. That puts a smile on my face.
I think compassion requires being vulnerable, being willing to give of yourself, to take on a little bit of the pain that the family or the patient is going through. I can have all the compassion in the world, and it's not going to be okay that they are losing somebody in their life that they love. But if I can reduce that pain a little bit by having the courage to be with them, being present is the most important thing at all. It doesn't require a lot of language. It doesn't require a lot of words. It requires just sitting sitting and being with people and not feel the need to have all the answers. It's okay if tears jump into your eyes as well. We are not robots. I've done this for 32 years. I still cry with people. Those are the things that I want all of us in healthcare to recognize, and it's certainly what Ken Schwartz talked about. To recognize that it's the small acts of kindness that go so far with these families.